Florence Acheng is a nurse here at Hoima Regional Hospital. This hospital is one of the many where she has worked in the 30 years she's been practicing nursing. She tells me that daily she deals with all sorts of patients from throughout the district, and by the end of the day, she's exhausted.
And you know, WHO standard, a nurse is supposed to look after 5 patients throughout the day. And a midwife is supposed to take care of 4 mothers who are in labor or during the time. But right now, a nurse generally is looking after 60 patients and a midwife is looking after 30. Eventually, if you start telling them from morning up to evening, talking to patients, the same thing, eventually, when it reaches the 10th, eventually you become good and tired, stress in your work. And our patients they come to public service as a last resort, and the number of people are so many.
Like Acheng, Annette Kabanyoro also tells of a similar tale, although hers is an experience of 15 years in the nursing fraternity.
The remuneration is poor. We have very many risks, like we have occupational risk hazards, we have a problem of human resource, increased workload, we have a problem of task shifting, we have many problems. The resources which we have are not enough to protect us, like for example, gloves, like aprons, like we'll be having those goggles and So the resources which we have, which would protect us, are not always there. So you find yourself exposed to many infections.
These challenges are not unique to Acheng and Kabanyora alone. Thousands of nurses in Uganda and many others on the African continent also experience the same, if not worse. Of the long list of complaints raised by the nurses, poor remuneration and unfriendly working conditions stand out and have been the major triggers for the mass movement of qualified nurses in search for greener pastures abroad.
Anybody called a nurse goes through what I am explaining. They find it difficult, and yet the salary is never talked of. We are on the front line. 24-hour coverage is by nurses, and the nurses, they are working exposed to a lot of infections. Look at the outbreak of Ebola. Who talks about a nurse today? Nobody. Personally, I worked in Ebola outbreak in Gulu. I was in the front line. We were only 2, me with the nurse in charge of the ward, then the doctor. We became 3, and Dr. Lukwia. So it was not easy. Nurses.
And that is the doctor who died, right?
Yeah, he died, but how many nurses died before him? And who talks about it? Nobody talks about it.
However, here in Uganda, there are other medical personnel that have chosen the less traded upon road and have opted to stay in order to serve the disease-burdened communities at grassroots. Dedicated Acheng Florence and Annette Kabanyoro are among them. These 2 nurses say nothing will deter them from their calling to bring physical healing to Ugandans. These services, however, come with optimism that one day the government and relevant authorities will finally address the plight of medical workers in the country, thereby improving the quality of healthcare. But this is long overdue.
If we got better salaries, then definitely we would be happy. We would come. Some of the challenges would definitely remain, like the increased workload would remain. But the challenges which I'm telling you, like you work, you are not happy, the landlord is chasing you away, you can't pay tuition fees, you have to rush and go maybe to window 2, so you leave these other patients maybe suffering because you have to run and get some other earning somewhere. I think the nurses would really get satisfied if the remuneration is okay.
The thing that helps us is having that heart that we are called to this profession by God. You work under limited resources. Sometimes there are no things to use. There is very little salary, and there is no appreciation whatsoever. Even patients abuse us. Even our colleagues, some of them don't recognize what we do. You are working with a doctor, you make a small mistake, you have done 100 mistakes. They multiply, and yet really the work of a nurse is something that ought to be really appreciated by everybody. Minus a nurse, there is no health sector. Ministry of Health stands because of nurses. Because when there is no nursing, then the ministry closes. A doctor comes, he has seen a patient, he has gone home. It is me, a nurse, to see that this patient gets the treatment and at the right time, the right dose. I run around. Is there food? I call the relatives. I talk to them. Bring food for the patient. Because these drugs go with the feeding. So you find the workload of a nurse is so huge that there has been no appreciation, as according to me, that has been given to nurses in this country.
We would like the government and all the stakeholders in healthcare delivery to ensure that they re-strategize, they go back to the drawing board, identify the issues that is affecting healthcare delivery, the issues that is affecting health workers in general, nurses and midwives in particular. Because nurses and midwives are the closest people to the patients and they work 24 hours round the clock.
Recently, the Parliamentary Committee on the Budget had locked horns with the Finance Ministry over the budgetary allocations for the Health and Defence Ministries for the new financial year.
It's not 260 billion. We moved from that position because it's not possible to find that money within this short time. So what Parliament has been discussing with the Executive is to find 39.2 billion. And of course, as the Ministry of Health, we were asked to work out the figure and see whether we need the 39 billion. And of course, we came up with the figure that is more than that. So government has assessed the recruitment requirements of the ministry and allocated 49.5 billion.
Human rights activists and the Budget Committee want Finance Ministry to cut the budget for defense and raise that of health in order to sufficiently support the health sector operations, but is yet to be concluded. The magnitude of the medical brain drain in Africa is staggering and so unprecedented that one Dr. Lala Ben Baka of the United Nations Economic Commission for Africa was quoted as saying that in 25 years Africa will be empty of brains. In 2006, the United Nations World Health Organization report said that more than 25% of doctors trained in Africa work abroad. Other African country reports have also made similar reports. For instance, Sierra Leone was said to have more medical doctors in Chicago than in Sierra Leone itself. The scenario in Kenya has it that only 10% of the 6,000 physicians trained in public hospitals every year remain working in the country's hospitals. 120,000 of the over 640,000 African professionals in the United States alone are medical doctors from Nigeria, Ghana, Sudan, Uganda, and Kenya. The nursing fraternity is lamenting when their colleagues, the doctors, are jubilating after government increased their pay recently. Nurses argue that the disparity in their pay may affect their morale at work and in the long run put severe strain on the health services and health institutions. Dennis Igoa, UBC News.